Hello guys, welcome to my YouTube channel. Let's join pharmacy. In this video, let's discuss about steroids are harmful or useful. Day to day in our life we are using lots of steroid. Okay, and these are harmful or useful. Let's discuss in this video. Uses, side effects, measures to control the side effects. Okay, how to control the effects of the steroids. That too we'll discuss in this video. The video is very informative video. Here you will get the total knowledge on steroids, so be until last. Yes, here first let's understand what is this steroid. See, steroids are the synthetic chemicals which mimic the testosterone or cortisol hormone. You know that these are the synthetic chemicals. They will mimic the activities, okay, of testosterone or the cortisol hormone. Now what is this testosterone? You know that testosterone, it is the male hormone, okay, which helps for the development, means for the growth development, for the reproduction, hair growth, muscle build. Testosterone is very important. Then now this cortisol or the hormone which is secreted from your adrenal glands, okay, that maintains the action of the anti-inflammation. If any wound happens, means this cortisol helps to fill the wound quickly, or any allergies happen, means this cortisol or these hormones, what they will do, they will stop the allergic reactions. These all are the basic functions of these hormones. Now our question about steroids are harmful or useful. Okay, this you understand what is the steroids, basic term. Now these steroids are harmful or useful. See, if we use steroids in limited way under the supervision of the doctor, it cures many diseases, or else it leads to severe side effects. This we will discuss in side effects later. Side effect session we will discuss there. Then now, for how long steroids can be prescribed? See, if you talk on the prescription or the prescribement of the steroids, it depends on the condition of the patient. But generally doctor prescribe for 4 to 12 weeks maximum. 4 to 12 weeks maximum. Don't worry, users also we will discuss later. Everything I am going to give a proper knowledge. Just you sit and listen these things what I am saying. Now our daily products contain steroid, or example for steroid, so we can quit it. Quit it means here to quit the steroids. Our daily products, what we are using, creams or tablets, does those contain the steroid content? How can we identify that? Now first, see in tablet session, betnisol. Betnisol, the content is betamethasone. Many doctors or many pharmacists, okay, while you are going for cough or allergies, they are giving this for you, okay, but that is betamethasone. Then Vicelone 5 mg, 10 mg, 20 mg, that contains prednisolone. Prednisolone, it is also a steroid. Predmet 4 mg, methylprednisolone. Predmet, this is also a steroid. Testosterone, okay, then methandione 5 mg. Bodybuilders misuse this drug, that is methandione. Bodybuilders misuse this one. Now see, how can we identify this, it is a steroids or not? See, you understand the last 3 letters, that is one, okay, one, betamethasone, prednisolone, then testosterone, methandione. If one ends means okay, manually it is a steroid. Now in creams, many ladies are using, many gents also nowadays they are using these creams for their brightness, to become bright face, okay, to maintain their aging property, they are using this. Actually it's not for that purpose. Like skin light cream, skin light they are using, betnovate they are using, 4-derm cream they are using, tenovate, pandramynium, these all contain steroids. Okay, for long term use it leads to very dangerous side effects. It leads to thinning of your skin, it prones the acne production. Then our next uses of the steroids. See, steroids basically they are used in suboptimal growth in children. In some children, what happens, there is a decline in the growth or a stop of the growth in children. So doctors will first check the testosterone level in the children. If the testosterone level is less, then we are giving the steroid to boost the testosterone level. In chronic asthma, we are using the steroids. Chronic, severe asthmatic conditions. Then reduce the cancer pain. Patient is suffering from severe cancer pain, at that time steroids are used. Spinal cord injury, at that time. Muscle development for weak candidates. Okay, they have less testosterone level. First we will test a testosterone. After that we go for the insertion of this testosterone tablets. Muscle development. Then osteoporosis. Okay, osteoporosis means from child age only they are having the less bone matter. Okay, to increase the bony nature we are giving this steroids. And increase in protein synthesis. Steroids gradually what they will do, they will suddenly increase the proteins inside the human. Then psychiatric patients we are giving this one steroids, etc. Then some of the side effects are there. Side effects, see one request to all of you, never use steroids without doctor prescription. Long usage of steroids leads to increased blood pressure, increased sugar level, fertility problem. Okay, fertility problem, improper menstrual cycle, polycystic ovarian syndrome, indigestion problem, weight gain, or difficulty in sleeping. This also one side effect. Muscle weakness, prolonged usage of this steroid leads to muscle weakness, increased growth of body hair both in men and women, lower resistance to infection. If any infection happens, means it won't goes. Okay, it won't goes faster. Infection, it leads for the prolongs. Acne, hair loss, mood swing, it is becoming very aggressive or short tempered with people. These all are the severe side effects. Then our last question, how to control the side effects by steroids? Already we have taken the steroids. Now how can we overcome by this steroid side effects? See, you do regular exercise. This is one of the very important one. Then meet the doctor immediately. Okay, doctor won't tell you to stop the steroids suddenly. They minimize the dose gradually. You are getting 150 mg, means he will reduce the dose like 25 mg. Then he will tell to take the dose in alternate days. Take steroids after food with plenty of water. This is very important. Then eat more potassium rich foods. Avoid processed food. Processed food, you have to avoid that. Try a reduced sodium diet. Guys, these all are about the steroids, which has become an essential partner of our life. So say bye to this partner, that is steroid. Thank you. Subscribe our YouTube channel Ledger Pharmacy. Hit the bell icon and also turn all that bell icon notifications, so that if you make a new video, means that video can touch you. Thank you.